Welcome. We do appreciate that caring for a PICC line can be a daunting task. Remember, you are not alone. You have this video to follow, and if needed, you can contact the Oncology Day unit. To start with, make sure you're both comfortable with enough space and a surface to work from. Wash your hands. Wipe the working area with an antibacterial wipe, spray or soap and water. This area is ideally a tray that is just used for PICC care only. Ensure that it is allowed to air dry. Gather your equipment. This is for one dressing change. Your pack contains equipment for 2 dressing changes. Dressing pack. Sterile gloves, these are in the dressing pack. Pre-filled syringes, 1 for a single lumen, 1 tube, 2 for a dual lumen, 2 tubes. Chloroprep sponge 3 ml. Grip lock securing device. Dressing. Clinell wipes. Vigone bung. Line cover, Tubafast or something purchased. Prepare your equipment by dropping it onto your clean surface. Start with the dressing pack. This will give you a lining for the tray. The dressing pack contains an apron, sterile gloves, a blue sheet, a rubbish bag, and a hand towel. Continue to open and drop the other equipment onto the tray, ensuring that you do not touch anything in the packets. Check you have everything you need. Carefully pick up the apron from the tray and put it on. Remove the fabric cover from over the PICC dressing. Wash your hands. Now place the blue sheet under the arm with the PICC line. You are now ready to start the dressing change and flush. With your clean hands, very gently remove the dressing. Start by slowly lifting the edges. The dressing might be sticky, but very gently pull back, supporting the skin underneath as shown. Ensure the line doesn't move by positioning your finger over the dressing where the PICC enters the skin. Continue doing this until the dressing is released. Wash your hands and dry them thoroughly with the paper towel found in the dressing pack. Put on the gloves from the dressing pack. The grip lock is now visible. This is securing the PICC line and is the last thing to be removed. Gently remove and open the tab and release the PICC as shown. This can be tricky as the line is now vulnerable to movement. The line is now exposed. Using the ChloroPrep sponge, clean the area. Lift the line and clean as shown. Drop the ChloroPrep sponge away from the dressing tray. Allow the area to air dry. This will avoid irritation to the skin. Take the backing off the grip lock and attach to the skin. Try to reposition this to help prevent skin damage. Lift the middle section and remove the backing paper. Lay the white T-shaped part of the line as shown onto the adhesive pad. Cover with the top layer of the grip lock, and the line is now secure. Lift the dressing and place it over the entry point of the line and the grip lock. Lower this into place. Try not to stretch it, as this can pull the skin and make it uncomfortable. Gently massage around the edges of the dressing. This helps to prevent rolling. Continue massaging the edge of the dressing while removing the backing supports for the dressing. Place the remaining dressing part to the top as shown. Ensure all paper backing is removed once placed. You have now completed the dressing change. In your tray, you will have a Vigone bung. This is also changed weekly. With the Clinol wipe, clean the end of the PICC as shown and remove the bung. Clean the area exposed once the bung is removed. Allow this to air dry. Gently pull the plunger down to allow you a clear view of the air in the syringe. Then gently push your plunger until you have a small bubble at the tip. You are now ready to flush your PICC line. Proceed to flush the line with the push-pause technique as demonstrated with the pre-filled syringe. Remember, the last mill is a push, twist and pull technique. This locks the line. Attach your new bung with a gentle twist until you feel resistance and it is secure. If you have had some reactions to the standard dressings used, you may be supplied with a sensitive dressing. Put today's date on the appropriate part of the dressing and apply overdressing. Remove your gloves. Cover PICC line with Tubifast or a fabric cover. Ensure that the line is secured under the cover. Your PICC line dressing and flush are now complete. Use the bag to dispose of the used items. This can be placed in your domestic bin. Wash your hands.